We are working extensively on emotional regulation, understanding the nervous system. Why do we act and react the way that we do? That's been our habit and our pattern of behavior. Hi, I'm Tiffany. I'm a primary therapist here at Pinnacle Peak Recovery. Each client will have the opportunity to sit down at least once a week and do one-on-one therapy, depending on what's going on with an individual. If we need to bump that up and do a little bit of extra work together, we absolutely can. And there's also an opportunity to bring in families and couples and friends, anyone the client identifies as a stakeholder who is in their environment and who might be helpful in their recovery. One of the primary modalities we use in individual therapy is something called polyvagal theory. And polyvagal theory is all about how our environment influences us, and we want to feel safe within that environment. So one of the primary ways we do that is through the development of the relationship between the therapist and the individual. Once that relationship is established, there tends to be a sense of trust and safety. And from there, we kind of reach out and we use cognitive behavioral therapy, which is CBT. We might use attachment-based perspectives, emotionally focused therapy. Our approach is very, very eclectic, and each therapist will use a variety of modalities that they have been trained in and feel comfortable in. If we have a person who is presenting with a lot of trauma and they are identifying, hey, I feel codependent, I'm relying on a lot of external sources in order to feel validated, we might structure our therapy sessions in a way where we are exploring independence, codependence, interdependence, and it is really a team effort between the therapist and the client. And in that case, the relationship itself becomes the teaching tool, because it's about experiencing a relationship in a way where there's not codependency, where we are able to dialogue and have boundaries. The only way people can truly process through their trauma is when their nervous system is at ease. We have to create a safe enough environment in order for people to feel uncomfortable and vulnerable, because that's where healing happens.